Welcome back, guys, for this third and last part of our webinars dedicated on ADHD medications in the Three Borough Adult ADHD service. I am Martina Carboni, as some of you may know already, and I'm a consultant psychiatrist in the team. And today, at this point for this session, it will be Alice to lead on our conversation on the logistics of how to access ADHD medications through our service. Alice, introduce yourself while I'm sharing the slides, please.
Hi, thanks, Martina. So I'm Alice, and I'm one of the nurses and non-medical prescribers in the Three Borough team. So at this point,
Yeah, sorry, Alice. I'm sharing now the main page that that has been shared or will be shared to those listening to this webinar. In this page, just for you to know, you will find three further web pages if you click on these links. We have discussed in the first session the rationale behind taking decisions on medication, which medications we can trial in the second part of this webinar. And now we are here. We're gonna discuss the hows, so the logistics. Let me see if these links, if this link works. Just allow me a few seconds to share it with you. I hope you can see it now.
yeah, that's all showing up,
Thank
which is
you. I will
good.
mute myself.
Thanks, Martina. So you will have been involved with our service to, as Martina said previously, either have an assessment for ADHD or have your diagnosis of ADHD reviewed, and that will have been with either one of the nurses or one of the consultants within the service. And at that appointment, the clinician will have discussed with you medication options and may have made recommendations regarding specific treatments for you, and included a link in your report to where you can find more information about that medication. So from that point of having that appointment, you will then be added to our waiting list that we have within our service for those that then need to come through to start and try medication. And you've probably heard the phrase titration quite a lot in the webinars and at points as well in your reports and assessments. So what does titration actually mean? So that's us starting the medication for you and increasing or reviewing the doses regularly until we get to a level where it's stable. And by stable, we mean we're getting the most out of the medication with as few side effects as possible. And what we're always aiming for is for you to be on the lowest dose of medication with the most effect. We don't want to be prescribing you unnecessary medication or at too high doses. The reason that you come to us as a specialist service is that primary care, so GPs, generally it's recommended that they don't initiate or start treatment for ADHD, and that's done under specialist care. So that's why you come through to us for that process. So you'll be contacted by our administrative team when you're at the top of the waiting list, and you'll be offered an appointment. And these appointments are generally in person. So the reason for that, as Martina previously mentioned, is there's a lot of monitoring that we need to do with regards to being able to prescribe for you, and that monitoring needs to happen in person. So the things we need to do are monitor your blood pressure and your heart rate at every appointment, and also your weight. As well, at the end of every appointment, if medication is decided, you'll be issued with a physical prescription that you will then take to a pharmacy. So coming to the appointments means that you can access that. You'll stay with us and having appointments with your nurse generally every 3 to 4 weeks. That will be agreed at your appointments until you're at a point where the medication is stable. So like I said earlier, that point where you're getting the best out of the medication with no side effects, at which point we'd be requesting that the GP takes over prescribing of your medication. That's kind of a bit of a summary of what we do. And the things we don't do. So we don't case manage, we don't risk manage, we don't crisis manage. So what that means is there are services out there for kind of physical health or mental health services where they'll take on a bit more of an overarching view of your care. Whereas we think specifically, we're specialists, we think specifically about that ADHD side of things. So we also won't review or monitor any other types of your medications. So that would still be done by whoever is prescribing those medications, whether it's other services or whether it's your GP. There are some instances where we can't prescribe medication for you, or we need to take a pause. And that might be if we're concerned about your physical health. So if those parameters that we're checking change, we might say, actually, we need to stop this for a period of time and request some further investigations. And again, we would request your GP to undertake those. Or if we had concerns about your mental health. And again, in those situations, we'd either ask your GP to manage that, or we may make onward referrals to secondary mental health services if it's needed. So you've had a long wait to get to this point already. So you've probably battled trying to get onto our waiting list. Then you've had your wait for the assessment, and now you're waiting for medication. And I appreciate that wait can feel extremely frustrating. And the waiting time does vary from when you receive your diagnosis or are reviewed in terms of your diagnosis versus when you have your initial appointment with us. And that can depend on a lot of different factors. So that can depend on our caseload, but it can also depend on whether investigations are needed. So at the point that you were diagnosed or had a review of your diagnosis of ADHD, the clinician might have said that we needed further information before we could safely prescribe medication for you. And there is a wait sometimes for that information to be shared with us. That will always be discussed with you if that's what we're waiting for. So once you reach the top of the ADHD medication waiting list, one of our admin team will be in contact with you to book an appointment in with one of our nurses. So that would be me or one of my colleagues who are all prescribers. You'll then, as I say, have appointments with us every 3 to 4 weeks. Whilst we increase your dose and review the medication that you're on at each appointment, thinking about the benefits of it, whether there's been any side effects, any unwanted effects, how your physical health is and how your mental health is. And that time that it can take between starting medication and finding your stable dose and your stable medication can vary. For some people, it can be months, kind of 2-3 months. For some people, it can take a little bit longer. Once you're at that stable dose of medication, like I say, we request that your care is transferred back to your GP, and the nurse will discuss that with you at the time. As there's 2 different formats that can take, but that will be explained to you when you get to that stage. So in whatever form it takes, when your care is transferred to your GP, if there's any problems with your medication, in the first instance, you should go to your GP to discuss that. They will take over the prescribing, they will issue your prescriptions, and they will do your physical health monitoring. So from there on, it's recommended every 3 to 6 months that you still have your blood pressure, heart rate and weight monitored. Don't worry if you can't remember all of this today. It's a lot of information to receive, and you'll be talked through the process and guided through the process by the nurse that you're working with throughout. So that's a bit of an overview of the process and the logistics of it. Martina, is there anything you wanted to add there? No? Okay.
Sorry, yes, I actually
Okay.
I was trying to mute and unmute myself. So sorry, everybody, for these technical difficulties. Yes, I would like to add just one little thing. There is an apology with those who have been waiting for our support, for the support that we can provide. It's something that we are very conscious about. The waiting lists are extremely long, and they can vary very much. So some people have to wait for years to get an assessment, and many months to get medication that they may really benefit from. We are aware and in pain, I would say, as clinicians, because thinking of this, because we are trying our best to reduce waiting lists, but it at the moment is very difficult goal, that of reducing the waiting time for diagnosis and titration. to a few weeks or months. And this is due mainly to the unprecedented demand that our service is overwhelmed by. We are trying our best. We cheer for you, we work with you, and we love what we have been doing. We would like to be more efficient to provide care in a timely manner. We are working on it. We are not just passively taking things as they are. We are far away from what we would consider ideal care. But we are working on it, and we will really appreciate if you had any feedbacks, if you had any suggestions for change at some point in the short to medium term. We will ask you to provide us with feedback about these webinars, and I can promise to you, we will make our best to learn from this experience together with you, and improve the quality of care that we provide to future patients. So thank you very much in advance for just taking the time to listen to us. And if you want, provide feedback and advice on how to improve what we've been doing with you guys. So thank you, Alice, and thank you to our listeners. And I hope to see some of you at some point for, who knows, an annual review. I wish you all the best for your treatment. Bye-bye, everybody. Take care. To the next webinar.